So for the next type of drug, which that's antibiotic drug, which we'll be discussing, it's pharmacology. We'll be talking about azithromycin. So pharmacology of azithromycin. So for the pharmacology of azithromycin, you can see this drug. This is azithromycin. Okay. So first of all, the classification of antibiotic that this drug falls under is macrolides. Okay, so it's a macrolide antibiotic. It has a broad spectrum of activity, so it's used in treating bacterial infections. Okay, so it will bind to 50S ribosomal subunits. Okay, that will inhibit protein synthesis by blocking translocation. Okay, so that action is what will now keep the bacteria in one place. It will make the bacteria not to be mobile, so they call that bacteriostatic. But it can also kill the bacteria too if you increase the concentrations. Okay, so it can both be static, keep the bacteria in one place, and also sedal, that's kill the bacteria. So spectrum of activity is effective against a lot of gram-positive bacteria, also gram-negative. Okay, like Streptococcus pneumoniae, Haemophilus influenzae, Mycoplasma pneumonia. So as I hear pneumonia, of course, you are now knowing that it's mostly used in respiratory tract infections. Okay, also Haemophilus influenzae, Mycoplasma pneumonia, Chlamydia, trachomatis, Legionella, pneumophila. Okay, so has activity against some protozoans too. Okay, azithromycin. So pharmacokinetics, absorption is usually given through the oral route. Okay, distribution is widely in tissues. Protein binding is approximately 7 to 50%. Excretion will be put out unchanged in bile. Okay, half-life is around 68 hours. Okay, allowing for you dosing it only once. Okay, so clinical uses mostly respiratory tract infections, right? Also skin infections, sexually transmitted infections, then some gastrointestinal infections, right? So resistance usually it can occur via methylation of 50S ribosomal subunits, efflux pump, where the drug is going into the cell and the cell is pumping it out. Then sometimes the organism can produce some enzymes that can break down the drug and all of that. Okay, so that's what we have here for azithromycin.